All right, good evening, guys. So it's Dr. Luo here. So we're going to show you a couple of ways that you can document a procedure note. So the first thing we're going to do is we're actually going to log in. And after you log in, if you press F10 or click on this little icon here, you'll get to the check-in, check-out office. Once we get in, let's say our first patient's at 9 o'clock, we're doing an epidural steroid injection. You can double click the patient. That will actually drag the patient directly to the right, and that's actually going to check in the patient. So we'll ignore the signature agreement, and after we get to this stage, we're going to double click on this. That's going to ask to create a visit note. So we're going to say yes, go ahead and create a visit note. After that, we'll get to a screen where it's going to show you everything you can under procedure note. So in the procedure note, you're going to have a lot of options to document. So mainly what you absolutely need to do is actually diagnosis and actual procedure note. So let's say we're using a template. The first demonstration we're going to do is using a template. So if we're using a template, there's a lot of icon here. It's very busy. So the first thing we're going to click is this little icon called selecting template. So let's say we're doing epidural steroid injection for transforaminal. So what we're going to do is we are going to select template, and we're selecting one of the template, either I created or you created. So in this case, I already created an epidural steroid injection called lumbar transforaminal L4, L5, and L5S1. We're going to go ahead and copy everything, and that will ask you to see if you want the diagnosis that's already in the template. So I'm going to say, yes, I do want lumbar radiculopathy. In this case, there's only one primary diagnosis, so we're going to select that as a primary diagnosis. And then it's going to associate it with a couple of CPT codes. These are what's already included in the template that I've chosen in the template as the medication and the contrast. So I'm going to say I want all, so you can individually click on each one of them, or you can just say select all. So after that, we're going to say okay. And it's going to wait a little bit, and after that, it's going to populate everything. So just a couple of seconds, and then we got a template here. So notice that it's going to have a chief complaint. This is already built in my template. It's going to have a diagnosis that's built in my template. And then it's also going to have the actual full note. So in the full note, you have a couple of things that's already in there. So it's already designated as bilateral L4, L5, and L5S1 epidural steroid injection. It's going to say bilateral L4, L5. So let's say if we need to make some changes to the actual template, so we can click on procedure, and it's going to have this already clicked down, which is what my template had. And then if you click on that, it's going to have a couple of options. So let's say we didn't do bilateral L4, L5, L5S1. We actually did L3, L4, and L5S1. And let's say we did some anesthesia instead. So I want to modify based on the template I just located. So from here, I know that because I did 2 levels, I'm going to be having the same code. So here it's going to be first level bilateral, and I'm not going to change the code. So I just want to show you where these codes are at. Because I didn't do the levels, I'm going to do a different level. So I'm going to say procedure performed, it's bilateral. However, I did not do L4, L5, and L5, so I'm going to do 3, 4, and 5, 1. Okay, the next thing I'll be doing differently is I provided anesthesia. So let's say I did anesthesia and I did IV with sedation, and then this is sedation by me, and then the vital sign was monitored by me, and the MA ANON, and click OK. And then the total time we did was about half an hour for this epidural steroid injection. So I'm going to bill 1, 2, and then the medication I've given 5 Versed. So I'm going to click on 5 Versed. So just remember to click these down, because these are built in with the CPT code. So we're going to bill 5 units of Versed associated with it. And then usually with the time, what I typically do is if you can remember, certain insurance requires a start time. So I do a start time 9 a.m. and then end time 10 a.m. It's not all insurance requires it, but certain insurance requires start time and end time. And then we'll double check our node. So we're going to do bilateral 2 levels. We're going to bill for bilateral L3, L4, and L4, L5 transfemoral epidural steer injection. And then, so this was 15 minutes, additional 15 minutes, 5 milligrams of Versed. And then after that, we're going to check the node. Oh, actually right here on the node, it says, at the node, it says filling of the nerve bilateral L4, L5. So we need to change that. So if you're not sure where it is in the node, what you can do is you can double click this. What it should do is that it should open up the part of the node. So let me try that. So I'm going to click OK to exit out from that template I just opened. I'm going to go back to this area, double click on this. It should open to the part where I'm supposed to edit. So we'll wait a little bit. Okay, so it's opening up. So it'll go to the procedure nodes in the nerve root bilateral. So under bilateral, instead of 4-5, we did 3-4 and 3-4, L3 and L4 nerves. Those are the 2 nerves that's filled. So I click OK. So that looks pretty good. So what we did, and then that feels pretty good. So if that's pretty good, we will go ahead and click on Superbill. So Superbill is the way to sign off the note. So after we click on Superbill, we will go ahead. We don't need to select any additional charges because typically what I build in the template is that I already have these built in the template. And so the medication, the CPT code for the 2 levels are built in, and then with the 50 modifier, I use dexamethasone, which is this one, and also methylprednisolone, which is this one. So those are built in, and then the contrast that's built in, and then the sedation code and the Versed code. So notice we charge 5 units for 5 milligram Versed. So that looks pretty good. So we're gonna say, let's go ahead and sign off. So we're gonna sign off here, and then the sign off will ask you to put in password. I already put it in previously, so I can just click on use existing password. So after that is done, you should see a notification that says on the right hand side that says signed off, and that's how we typically do a note with a pre-procedure template. All right, so we're gonna close this window. We're gonna look at the next patient. Now we're gonna do a procedure that we did it completely from scratch. We have not done this patient before. So we're gonna double click this patient and then click OK, and now the patient is checked in, and then ideally all these are done with the after the check-in process, so you don't actually have to deal with these forms. So I'm gonna click double click the visit and the patient, and then it's gonna have a new note. Ask you to add a new note. So we'll say yes. So after that, we will do a totally different procedure I don't have a template for. So something I don't have a template for is thoracic interlaminar epidural steer injection. So we'll go ahead and do that. And so in this time, we actually need to add a diagnosis. So first we click on diagnosis and decision. So we click on thoracic, and thoracic radiculopathy is what I'm gonna use. And I'm gonna say add diagnosis. And notice that the patient came with a couple of diagnoses already today. And so I'm gonna add that as a diagnosis. So let's say if you wanna search for something new, a new diagnosis, let's say I wanna say chronic pain syndrome. So you can simply click that chronic pain syndrome and then click on search. It's gonna have chronic pain syndrome. You can double click it. And now chronic pain syndrome is added on the bottom. Again, it says search new. So I like what I have a diagnosis so far. So I'll say, okay, that looks pretty good. So I have that. Oh, and also the thoracic radiculopathy is clicked, but you have to actually add it down to the diagnosis. So it's down here. Everything down here is actually where you're gonna be added. So if you simply click here and you just check here, it won't be added initially. You have to kind of add it to drop it down. So we're gonna click OK here. And after that, remember we're creating procedure note that's completely new. So here we're gonna click procedure and we're gonna go to the thoracic epidural serum injection. So far all of these templates are almost all built. All the cervicals are built, all the lumbars are built except for lumbar sympathetic. The thoracic, all of them are built. The shoulder and the hip joint, SI joint, all of them are built. So let's click on our thoracic interlaminar epidural serum injection. So all these are pretty straightforward. So I'm gonna say it's me. Pre-procedure diagnosis, we selected a thoracic radiculopathy. Post-procedure diagnosis, we said the same. So notice that all the clicks, all the actual items will show up on the right side. So in the code, we're gonna say, this is our code, location. It's gonna be the LV Gutenberg office. And then procedure performed, we're actually entered on the right side. Let's say we enter around T7, T8. And then anesthesia wise, we did not do any anesthesia, we just did local. And then, so we're gonna skip sedation, we skip vital signs, we're gonna skip total time, we're just gonna skip medication because we didn't do sedation. And then we're gonna go down to fluoroscopy. Let's say we did like 14 seconds total for the procedure. And then procedure note is where the meat of the stuff is. So we're gonna say we prep with alcohol and betadine. We did not do an IV, we did C-arm for localization, we did on the right side. If you don't want to say specifically, you can just click on the C-arm. So it'll say the C-arm was used, the laminar vertebral body was visualized, non-specific. And then we used local, we did some 1% lidocaines, and we did, let me click that down. So we used lidocaine, and we did, let's say 2 ml lidocaine. Gauge, we did a 20 gauge 2E needle. So you have to click on 20. And then loss of resistance, we used air. And then contrast, we did use 3 mLs. Epiduralgram was obtained. And then if you click on other, you would have to explain something, something else has happened. And then medication, we're gonna click on, so in this particular case, I use some lidocaine, and I use some 1 ml or 1.5 ml. We use saline, and then we use 1 ml, and we also use some dexamethasone, some steroid. And then after that, aspiration is negative. And then we're gonna end the procedure, and then patient will go home with family member. So you can check your notes real quick, make sure you're satisfied with everything. So everything's satisfied, make sure you click OK here. So I click OK right here. It's gonna take a little bit to computerize everything. And so now we get to this note over here. And so after the note is done, we will need to sign sign the actual note. So the signing of the actual note is called super bill. So the super bill, if you can click on this. So notice that, just one thing, notice that everything is filled out is blue here. And one thing you'll notice is that the prescription is already blue. I actually did not send a prescription during this note procedure, but I actually used the patient as a test procedure to send a hydrocodone earlier, so it accidentally showed up here. But just so know that it automatically picked up, hey, you sent a Norco today. And so if we click on super bill, that's how we bill for the actual procedure. And so when you click on super bill, you just want to double check, are all the procedures that we bill correct? And you'll notice, hey, something is not adding up. So we will actually pause for here for a little bit. All right, so let's try one more time. So earlier I was not able to get the super bill to show up. I think when I went back to check the template, the 6232 run was actually not automatically built in. So I just went ahead and fixed that real quick. So now after that, after you click down all of those options, so what are gonna be the things that show up? So we use dexamethasone, so that showed up. We use contrast, that showed up. Lidocaine, bupivacaine, we don't bill for, so we can't really build a CPT code, and then most importantly, our 62321, which is the interlaminar cervical thoracic, it showed up. So all that looks pretty good. So we'll go ahead and sign off on the note. And again, my existing password is already here. If it's not here, you can type it in twice here. So I'm going to go ahead and use existing password. And once again, after you sign off on the procedure note, what you'll notice is that this little green thing, it says signed off. So, and that's how you do a procedure note two ways. The first way, you can add as template. The second way, you can use the click form to actually click everything down. So if you're really happy with this clicking and you do want to save it as a template, what you can do is you can click on something called save as global template, and you can save this as global template. I am personally not going to save this particular thing as a global template, even though I have not created a template for thoracic, for a couple of reasons. One is that when you save it, you got to make sure you click down, instead of Lone Star, you got to click down all of the offices. And so if you don't click on all of the offices, it'll show up and it's going to say Lone Star office on the top when you load the template. Another thing you'll notice is that the patient's allergy has been already automatically populated in. And same with the current medication that's already automatically populated in. And also the medication that's we prescribed. So if you save the template as is right now, this patient's allergy and current medication are actually going to transfer to the next patient, which is what you don't want. What I recommend is actually you go to setup, visit note, and then you go to something called global template. From there, there's a screen, then you can actually create a template, and that's a better way to save a clean, like, blanket template for yourself.